everybody. Welcome back to the world's okayest physical therapist podcast. I'm your host, Dr. Hint, and today you are joining me on the live session for the sauna. Now, before I get going, as always, this isn't medical advice. This is just educational. I tend to focus more on the veteran population more recently, but the thing with the veteran population is they're just like everybody else, except they're usually more just injured, a little bit more older in their presentation. Like I think there was a study that I referenced a couple podcasts ago that said your average veteran is aged 10 to 15 years more than their actual age. So if they're aged 30, you're looking at a biological age of between 40 and 45. So they're just like everybody else, except they're a little bit further along biologically, which means they're more likely to have issues. So this is going to be geared towards the general population, but I might have some tidbits where I talk about veterans and how this can specifically benefit them. So welcome to the podcast. Don't forget to like, comment, share, subscribe, and let's get going. So I want you to imagine sitting in a room. It's 180 degrees. You're sweating profusely. Your heart rate is climbing like you're doing cardio on the Stairmaster. Most people would consider that a form of torture. But what if I told you this could be one of the most powerful recovery tools that you are not using? I'm Dr. Hint, and I'm a physical therapist, and I'm your host for Mission Ready Body and the world's okayest physical therapist podcast. And today we're going to be talking about the sauna, not the spa luxury version, but the evidence-based, performance-enhancing, longevity-producing or promoting version. And we'll be diving into what the research actually says, how to use it strategically, and why it might become a part of your routine, assuming you've been cleared by a medical professional to use it. This is not about relaxation, though that could be a nice bonus for you, I guess. It's more about using controlled heat stress to make your body more resilient, to recover faster, and to potentially live longer. So let's dive into it. Full disclosure, I used to hate the sauna. I wanted nothing to do with it. I worked at the YMCA for 5 years, didn't use it once. My job was going down there making sure people didn't pass out where they were using it. But a couple of years ago, I started listening to other podcasts about the potential benefits. I started hearing about how executives on the West Coast were starting to hold meetings in the sauna because of the longevity benefits that it purportedly had. And I listened to a Dr. Andrew Huberman podcast that really turned me on to it. So now I am lending my voice to the same cause, saying, yes, we should consider the sauna. I thought that it was originally just sitting there wasting time sweating, or that it was part of the woo-woo detoxification side of things, but that's just not the case. Once I started digging into the research, I started finding out the cardiovascular benefits and how they're comparable to moderate level exercise. I learned about their improved recovery markers, potential longevity effects, how heat shock proteins respond. Obviously, they increase, and how they can protect against cellular damage. And suddenly, the idea of sitting in a hot room for 20 minutes didn't sound like a waste of time. It sounded like a strategic recovery. It sounded like an investment. So what we're going to be covering today is going to be the types of saunas and what actually matters about them, the physiological effects of heat stress, evidence-based benefits for the cardiovascular recovery, longevity, and mental health, practical protocols. That's going to be on Patreon. I'm already going to warn you. I'm not going to bore you guys to death with all the different protocols, but you can find them on Patreon. The safety considerations and contraindications, and how to integrate the sauna with training. Now, again, important note, this is educational information based on research. This is not medical advice. If you have cardiovascular disease, are pregnant, or have any medical conditions, or are a human being, you should consult with your physician or medical professional before starting sauna use, because it isn't something that you want to play around with. Trust me, I've dealt with enough people that have passed out in there that it's not a joke. So we're going to start with the different types of saunas. The very first one we're going to start with is called the traditional Finnish sauna, which does bother me a little bit because my ancestry is Norwegian, and it burns me that the Finns got this one on us. This is the classic wood-lined room heated by rocks or an electric heater. The temperature ranges usually from 150 to 195 degrees Fahrenheit. If you're a communist, That's 65 to 90 degrees centigrade. The key part is it usually has a low humidity, about 10 to 20%, though this can change as someone pours water on top of those rocks, which creates the steam, which temporarily increases the humidity and makes the sauna feel hotter. This is the type of sauna that most of the research is based on. When studies talk about sauna benefits, they're typically referring to the traditional dry finish sauna. Okay? So whenever I reference research says, this is the type of one that we're talking about. Next, we have the infrared. That is not infrared, infrared. It is infrared sauna. This uses infrared lamps to heat your body directly rather than heating the air. And it operates at lower temperatures, usually between 120 to 150 degrees Fahrenheit. Again, for you communists out there, it's 49 to 65 degrees centigrade. Why does this exist? Well, the idea is that it penetrates deeper into the tissues while still offering the same benefits, but at a lower temperature, which is more comfortable for people that don't want to sit there in something that's almost 200 degrees Fahrenheit. The reality is there is much less research supporting it. There are a few head-to-head studies that suggest traditional saunas have superior cardiovascular benefits, likely because of the higher temperature, which causes it increased physiological stress, which gets the benefits that we're going to be talking about. So what is my take? Infrared isn't bad, but if you're choosing based on evidence, traditional sauna is going to be the winner. Now, one of the things you might have noticed trending on TikTok, Instagram, social media, Facebook, is how they're starting to sell these like space blanket boxes with a heater inside that is usually infrared, and they're starting to call that like a portable, cheap sauna. I'll talk about this later in the podcast. But again, that's infrared, and I don't think you're going to see that has as much benefits as the other traditional Finnish dry sauna. Next, we have the steam room. This is also called the wet sauna. High humidity, about 100%, though the temperature is lower. This is kind of like a Turkish bath. The benefit is that the high humidity will prevent you from effectively cooling through sweating and evaporation, so you heat up quicker even at a lower temperature. Some people can tolerate this better. I will say, I always thought of trying to even go. I've never gone into the wet sauna. The thought of even going in there and having to be stuck with that much humidity around that many other people just is an instant turn off for me. Research, there is significantly less research on the wet sauna than a traditional sauna, though it likely offers some of the same cardiovascular benefits. We just do not have the depth of data, so we can't really say it's as evidence-based, unfortunately. Now, finally, we have the hot tub and immersion, which is not a sauna at all, but because we're thinking of heat as a modality on this podcast, it makes the list. Technically not a sauna, but it's a similar heat stress principle. The water immersion is usually between 100 to 104 degrees Fahrenheit. Benefits: buoyancy is going to reduce joint stress compared to sitting there, I guess. It's going to be good for people that have significant joint pain, but the problem is it's going to be harder to achieve a sustained high temperature that will drive cardiovascular adaptations, right? It just makes sense. It's not the same as the other saunas, and it's not going to be as hot, so you're not going to get the same physiological stress. So what is the takeaway? The bottom line is that temperature and duration matter more than the modality. Modality is just a fancy word for saying how the heat is delivered. The research consistently shows benefits when you achieve sustained core temperature elevation. That typically requires a temperature between 170 to 195 degrees Fahrenheit for a traditional sauna, and it usually takes between 15 to 20 minutes minimum. The frequency for most of the studies that we're going to be talking about is 4 to 7 sessions per week for maximum benefit. I'm going to take a sip of this coffee here. But the thing is, you can achieve similar effects with different modalities if you're creating sufficient heat stress. But traditional Finnish sauna has been the most researched, and so that's what we're going to focus on for the rest of the episode. Any questions? No? We move on. Thanks for being here, by the way. Really appreciate it. Oh, man, I left one of those little dots out there. Dr. Hint, what are you doing? What are the immediate effects? Well, cardiovascular response. Within minutes, your heart rate is going to increase. If you're wearing a smartwatch or a heart rate strap, you're going to notice this pretty quickly. Usually it goes from a resting rate of 60 to 70 degrees, or sorry, 60 to 70 beats per minute if you're uncaffeinated, to 100 to 150 beats per minute. This will depend on the temperature, it will depend on your fitness level, but it will eventually be comparable to moderate level exercise if you're in there long enough. What's happening is your blood vessels are dilating, getting bigger, right? That's called vasodilation. This is particularly true around the skin, and it's going to help facilitate heat dissipation. It's going to increase blood flow to the skin by 5 to 10 fold, not 5 to 10%, not 5 to 10 times, 5 to 10 fold. Why is this important? Let's camp on this for a second. When your blood vessels dilate, they increase in size. What they're doing is becoming more permeable. They're becoming more leaky. They're allowing more fluid to seep out into the surrounding tissues, which not only hydrates that surrounding tissue, but in this case, it also allows sweat to form and to help you cool off. What this does is effectively exercise your blood vessels. It's forced them to expand and then eventually contract. Expand and contract. It's the same thing that's going to happen when you're exercising. Those same blood vessels will dilate. Cardiac output is also going to increase by 60 to 70%. Now, you might be saying, what is cardiac output? It's the amount of blood that your heart is pumping out. There's an entire lecture that I could do on this, but let's just say that your heart is working harder and pumping more blood through your body. This means your heart is working and it's creating cardiovascular stress in a good way. Thermoregulation. Your core temperature is rising, usually between 1 to 3 degrees Fahrenheit above baseline, and this helps trigger that sweating as your primary cooling mechanism. Now, fun fact, you can sweat anywhere between half to 1 liter per hour in the hot sauna. I know, I'm sorry, it's communist measurements, but it's just what the data says. I'm sorry. That is significant fluid loss, which is why hydration is critical, both before, during, and after. Now, let's talk about the really cool part, hormonal response. Heat stress triggers a release of several hormones. Growth hormone, which can increase between 2 to 5 fold, which helps support tissue repair and recovery. Norepinephrine. I know I'm dropping crazy names on you guys. This is not norepinephrine, it's norepinephrine. This increases focus and attention, and it can double or triple. Prolactin increases, which we're not really sure, have anti-inflammatory effects. And then finally, of course, everybody's favorite stress hormone, cortisol, which is a mild, acute increase, which is a good stress because it's related to hormones, and it's going to come down afterward. But it's basically going to help facilitate tissue healing. Pretty neat, if you ask me. The cellular effects, what's going on at the cell level. This is where Dr. Hint's knowledge of the cell and molecular biology really helps come through. Heat shock proteins are really interesting, and they're definitely something you should look into. Heat stress activates heat shock proteins. They're called molecular chaperones. It's the same sort of idea when you go to a middle school dance and there's chaperones making sure y'all don't get too close to each other and nobody's smuggled anything they shouldn't. These chaperones protect cells from damage. They can also repair damaged proteins, and they prevent proteins from all sticking together, causing cellular dysfunction. You can think of your heat shock proteins as a cellular level defense system. They help the cells survive stress. The cool part is once they're activated, they're going to stay elevated for 48 to 72 hours after the sauna, providing up to 3 days of ongoing protection. Why does this matter? Heat shock proteins are implicated in longevity, neuroprotection, resilience to other life stress. When you stress your system using heat in a controlled way, you're helping it to handle other life stresses better. I don't want to say it's like a life vaccine, but it's basically helping you handle generalized stress more healthily. Mitochondrial benefits. Some research suggests heat stress may improve mitochondrial function, which just means better energy production down there at the cellular level. And then finally, of course, the anti-inflammatory effects. We talked a little bit about prolactin possibly having a role in that, but this is also a fact. Regular sauna use is associated with decreased inflammatory markers. These are just proteins like interleukin-6 or CRP that just decrease with sauna use. And that's something they measure just by doing like sort of blood draw and blood work sort of things. But it's not local. I don't know how it could be local, but it is systemic, meaning that your entire body will have decreased inflammation markers, which will just mean decreased inflammation, likely in the joints and in the body and anything else that's going on. Now, let's talk about the adaptations over time. Plasma volume expansion. Your blood volume will increase because it's adapting to losing fluid. This will improve your cardiovascular function and your thermal regulation. Cardiovascular function because your heart is going to be getting a workout and it's going to be able to pump more efficiently with more volume. Thermal regulation because when you come to deal with heat, you have a reserve volume that you're able to sweat out. Improved sweating efficiency. Shocker. I'm not even gonna elaborate. It makes sense, right? Enhanced cardiovascular function. This is what I was talking about earlier. The improved endothelial function, which is blood vessel health, which helps reduce arterial stiffness. That's what I was talking about in terms of the cell or the blood vessels dilating and contracting. When they dilate, that's improving their function. It's making sure they stay porous. They can allow fluid to come out, which allows immune cells to come out, and they do their job, and then they're able to contract. It's basically giving them a workout. But this, as you can imagine, because it has to expand and contract, this is going to improve their flexibility and reduce the chance for stiffness, which is part of like atherosclerosis, right? As you get that fat in there, and it increases the stiffness of the blood vessels. And this is going to be one of the things that we check with the data. You can imagine how it could improve cardiovascular health and longevity. Healthier blood vessels just mean a happy, healthier life. There's actually a lot of really cool research out there as well about how blood vessels can respond to different proteins and release their own hormones and proteins to communicate and say, hey, we're dealing with some sort of thing. We should increase inflammation. It's a whole thing. Also, it basically helps you increase heat tolerance. Shocking absolutely nobody, right? That's just common sense. Oh man, I did it again with those little dots. Oh, it's bothering me. Oh well. The sauna is a beneficial stress that helps trigger adaptation, just like lifting weights breaks down muscles, which get rebuilt later as you recover. Heat stress challenges your cardiovascular and cellular systems so they can adapt and become more resilient. So let's talk about evidence-based benefits. One, cardiovascular health. This is the area that is covered by the most robust research, and it is impressive. There was a landmark study, it's called the KIHD, which stands for the Kupio Ischemic Heart Disease Study, which followed over 2,300 middle-aged Finnish men for 20 years. It's quite a long time. The key findings were this. The men who used the sauna 2 to 3 times a week had a 27% reduced risk of cardiovascular death compared to those who used it once a week. The men who used the sauna 4 to 7 times a week had a 50% reduced risk. This means that the researchers believed there was a dose response relationship, a dose dependent response relationship, that the more the sauna was used, the better the outcome for the patient was, or for the person in the study was. It also showed a reduced risk of all cause mortality, not just cardiovascular disease. There were other benefits as well. There was reduced blood pressure between 50 and 10 millimeters of mercury reductions in the individuals that were already hypertensive. That means their blood pressure was elevated. Improved arterial compliance. That just means that their blood vessels were less stiff. Reduced risk of sudden cardiac death. I don't know how you measure that, but I guess it means that you didn't die. And then improved symptoms in heart failure patients. These are patients that means their heart it's not able to pump enough blood. I guess they were going in there and still getting used to the sauna, and they saw improved symptoms, likely by just surveying the people and asking, how do you feel? So the mechanism, again, is cardiovascular stress. The heat helps mimic moderate exercise, and this means that you're still able to train the cardiovascular system without the impact on the joints or muscles from like running, cycling, swimming, and all the above. For the veteran population, this means that chronic joint pain, if that's what's limiting someone, and they've, again, talked to their doctor, they've been cleared to use a sauna, the sauna might be an effective tool because it helps elevate the heart and mimic that cardiovascular exercise, all without ever having to get onto the pavement and go running and aggravate that knee, ankle, or hip or low back. Something worth talking to your doctor about. Recovery and performance. Post-exercise recovery. This is how I use it. I use it typically after I've exercised. Studies show that sauna after training can cause reduced delay or it can help reduce the delay of onset of muscle soreness, which is DOMS, improve perceived recovery. That's right. I feel like I'm way more swole and recovering so much better than normal. And it can potentially speed up adaptation to training. The mechanism for this is increased blood flow to the muscles, the reduced inflammation, the growth hormone release, which is supporting tissue repair. Now, this is completely anecdotal. It has no evidence to back it. I've not measured myself. I haven't done anything like that. But I will promise you that me sitting in the sauna after exercise, I feel like I retain my gains longer. And I feel like my muscle mass has increased since starting the sauna. And I do attribute that to the growth hormone. That wasn't necessarily what I was going for. I do wonder if there's a genetic history, right? I'm Norwegian, nor the Nordic people definitely use saunas. I imagine, if ancestrally or genetically, my body's primed to respond to the sauna this way because that's how my ancestors, I don't know. But I can say that I didn't intend to go after the growth hormone benefit. I just wanted to have a happy, healthy, long life and my heart to be healthy because, and my family lineage, we have my grandfather who had like 6 massive heart attacks and then died. So I'm trying to prevent that from happening. But growth hormone after exercise, pretty awesome with that like 2 to 5 fold increase. Endurance performance. Multiple studies show that 3 to 4 sessions of post exercise sauna can improve time to exhaustion. That just means until you're so exhausted you can't keep running. Plasma volume, which is going to be really important for runners because runners actually, because they're sweating, they lose that volume. And that's one of the things that causes their heart rate to increase. They start out pretty hydrated. They start out not really sweating. As they run, they lose that volume, right? Which means their heart has to work harder and harder and harder, which is going to fatigue them, which is going to lead to that endurance failure. And then finally, of course, it can help with thermoregulation during exercise because they're going to get hot while they're running. It's going to help them cool down. One study, just one, said that runners who added the sauna for 30 minutes post-workout 4 times per week for 3 weeks improved their time to exhaustion by 32%. Makes sense. They're basically increasing their blood volume, which means they're going to be able to run longer with increased blood volume, which means their heart likely won't have to work as hard as someone who doesn't have that similar volume. The practical application is that if someone is training for endurance and they have been cleared by a medical professional to use the sauna, adding a post-workout sauna can enhance adaptations. It's like adding volume for your running and your training without actually adding the increased stress on your knees, ankles, hips, and low back. Now, for longevity and brain health, it actually helped decrease Alzheimer's and dementia risk. The Finnish cohort that they were talking about, the 2,300, it showed a 66% reduced risk of Alzheimer's and a 65% reduced risk of dementia. This is observational data, so there is no link to the sauna. It just means the people that they were surveying less of them had Alzheimer's and dementia. But it's a strong association because they even adjusted for other lifestyle factors. Potential mechanisms. How is it doing this? Improved cardiovascular health. Are you tired of me saying that yet? Heat shock proteins, which can provide neuroprotection. I do wonder how much that is going on, and we just don't realize it yet. The reduced inflammation. Again, if you're decreasing inflammation systemically, if you have brain inflammation or inflammation markers, and it's increasing those chronic inflammation markers. I imagine that's going to impact your brain function at some point. There's no way that you can be chronically inflamed for years and that not impact your kidneys, your livers, your brain, all that stuff. And then it also could improve the blood-brain barrier integrity, which just means, I guess, better hydration of the brain, better nutrients to the brain, probably also playing some sort of role in terms of like the blood vessel health, which might play a role with preventing protein buildup. I don't know. That's an interesting one they're going to have to study. It also has a link to depression and mental health. Emerging research shows that regular sauna use may reduce the risk of depression and improve mood. But to be honest, some of these studies, they have things like if you eat sauerkraut from Germany every day, you too can also eliminate depression in 3 months. Actual study that I saw on Instagram. So, for depression and mental health, we also know that the gym is one of the best things for depression and mental health. And a lot of the people that use the sauna also work out. So who's to say? I don't know if they really control for that. Many regular sauna users report better stress management and improved mental clarity. The mechanism for that may involve the meditative like aspect of sitting still, focusing on your breathing, combined with the endorphin release, and then combined with the hormonal release and the forced parasympathetic activation of your nervous system. Another interesting one is pain management. Studies in chronic pain populations, think people like fibromyalgia, rheumatoid arthritis, chronic low back pain, things like this. Regular sauna use was linked to reduced pain levels. How does it work? It's the increased blood flow to the tissues, reduced muscle tension. So the muscles are relaxing. As they relax, you get decreased pull through those muscles, decreased sensation of the nerves going to the brain saying, hey, we're under pressure. Maybe this is a painful stimulus. Endorphin release and anti inflammatory effects. Now, my personal experience is, again, going back a couple of years ago, these are the sort of people I would have thought would need to stay away from the sauna. But again, that's why it's up to talking to your medical professional, talking to your doctor about if you have these issues, if the sauna is right for you, because your doctor is going to be able to go and do the studies and research this and say, hey, actually, I've read where some studies have come out and said the sauna is right for you. I haven't really seen the pain management side personally work for people in the sauna. I guess, though, there is some studies out here that say it. Next, immune function. This one was actually a little bit interesting, but basically using the sauna showed a reduced incidence of the common cold in regular sauna users, which is funny to me. Enhanced immune cell activity. Reason for this is, of course, your body when you have a fever. The reason why it's creating the fever is to make your body less it's going to make it harder for bacteria and fungi and all those other things to replicate inside of you. Your body upping the temperature is trying to kill other biological organisms, and it's what happens when you do that, though, is your immune system is adapted to operate better at a higher temperature, so it makes your immune system even more effective. So that's one reason why sitting there at a higher temperature is going to increase your immune cell activity and make them a little bit more effective. It can also increase white blood cell count acutely after the sauna. This doesn't mean that the sauna is preventing illness, but it may support your overall immune resilience. And again, the heat stress may prime the immune system, similar to how the fever does. And that's not even taking into account the heat shock proteins, which also could be playing a role. Now, let's talk about what the sauna doesn't do. It does not detox you. There is no detoxification. There is no sweating out the toxins and the heavy metals in any meaningful way. That's what your liver and your kidneys are for. Sweating is thermoregulation, not some crazy cool technique to get all the toxins and terrible things out of you. Significant weight loss. You're losing water weight, not fat. Hydration before, during, and after is critical. What a lot of people, like when you see with the UFC, what they'll do is they'll sauna till they lose all that water weight. And then what do they do right after they weigh in? They go and they eat and they drink and they gain it all right back. It is not an effective weight loss tool. You're losing water weight. Cure chronic diseases. No, it's a supportive tool, not a cure. So it's not going to be a silver bullet. The health benefits are real and they are significant, but there's no need to oversell it and claim that it's a cure-all. So let's talk about protocols. You're going to have to go to Patreon. That's where they're going to be posted. I'll try to get them up later. I know, what a shameless plug. But in general, you have to be cleared by a medical professional. You're looking at something between 170 to 190 degrees Fahrenheit, 15 to 20 minutes per session, 4 to 7 times a week. And they recommend 24 ounces of water prior to the sauna minimum, including water during the sauna, and of course, hydrating afterward. That doesn't include electrolytes. But we are not going to dive into like the 4 or 5 different protocols that I was able to find. So let's move on to the next one. Practical considerations. But first, safety and contraindications. I don't have a slide for this. Contraindications. People that everybody agrees, the research agrees, should not use the sauna. Unstable angina, that means chest pain, unstable chest pain, or recent heart attacks, anyone that has severe aortic stenosis, an acute infection with a fever, and pregnant. Everybody agrees these people should not use the sauna. Nope. The other ones that it's like, hey, you might have this, but you need to talk to your doctor before you even think about it. Again, this is all educational. This is what you would read in a textbook. This is not medical advice. This is what you would read in a textbook. Would be cardiovascular disease, including heart failure, arrhythmia, uncontrolled high blood pressure, taking medications that impair thermoregulation, like beta blockers or anticholinergics, history of orthostatic hypotension, like when you stand up and pass out, chronic kidney disease, and multiple sclerosis, or any other condition that's worsened by heat. This would be what you would read in a textbook or in a class if you're sitting, coming a DO, an MD, or a DPT. If you're sitting in class, this would be what they'd say, hey, make sure you know these for the test. Again, you should be talking to a medical professional before you even set foot inside of the sauna. So let's skip ahead to practical considerations. Gym memberships. A lot of gyms, my gym has one. That's how I get into the sauna. It's the easiest place to find them, but it's also the place where it's going to be most likely crowded. Home saunas are becoming increasingly affordable, so says the studies, between $2,000 and $6,000. If you have the space for it and use it 4 to 5 times a week, though, it's going to pay off. Infrared blankets, those are the kind of ones I was talking about too. It's going to be like a space blanket box, and you just get inside and you turn on the infrared. They're not ideal. They're lower temperature. They have less robust effects. But for a lot of people, they're better than nothing. And right now, the price range is anywhere between $300 and $800 from what I've seen. Community saunas. Some cities, in different cultures, different countries, have like a communal sauna, and it's usually anywhere between like $20 to $40 a visit. That's just not sustainable for a lot of people, especially if you're going 4 times a week. That's nuts. No matter what, once you have access to a sauna and you've been cleared by a medical professional to use it, the goal is to build the habit. You have to think of it as non-negotiable scheduling. It's almost like you're planning on going to the gym for a training session. I do mine post exercise. I'm lucky to get in there 2 to 3 times a week, but that's what I do. And something is always better than nothing. I wish that I had time to do it more, but I don't. So the one thing they recommended, though, that I thought was interesting is don't do it 4 to 6 hours before bed. That's just because of the hormone release and the possibility that's going to interfere with restful sleep. What to bring: towel, water, and a watch or timer. You'll be surprised when you get into the sauna, and most of the time it's dark, and most of the time you can't see the clock. And when you're watching the clock when you go in, you might say, hey, it's 6:35. I know exactly what time it is. Once you sit down, you're going to forget. You're going to not remember if it's 6:30 or 6:40, and it's plus or minus 5 minutes. It's easier if you just bring a watch or a timer, or obviously if you can sit in view of the clock and you watch. Because once you get in there, once you're really sweating, and you're sipping on your water, there's going to be times where you're going to forget when you went in. Optional things. I've seen people bring obviously like their phones, their earbuds. I don't bring my phone in there because I don't want to ruin it. I do bring headphones in there sometimes, though they immediately overheat. So that doesn't really work. Some people bring books. I'm not against that. It's hard to read in there because it's dark. Etiquette. Don't be loud and annoying. Don't walk in with your phone blasting your loud music or watching TikTok and Instagram at 1,000%. No one likes it. Nobody wants it. It's really annoying. And it kind of ruins the ability for a lot of people to relax. I can't believe that has to be said, but even at my gym, people do that, and it's really annoying. So considerations. Let me see here. I don't sacrifice training sessions for the sauna. The sauna is supplemental. If I only have 60 minutes, I'm going to train for my 60 minutes. But if I can add 20 minutes after the sauna, because I know, for example, I've already meal prepped, that's what I'm going to do. I don't say, oh, I have 60 minutes. That means I can only work out for 40 and I have to sauna for 20. Even if I work out for 60, I'm like, I got 10, 15 minutes, then I hop in. But I don't, I don't sacrifice my lifting for the sauna. I also listen to my body. So if I'm in there and I'm starting to feel weak and fatigued and a little bit lightheaded, I'm out. I'm done. That day is not the day to mess around and find out. One thing I'll add that I didn't say earlier: if I start my gym day with the sauna, I find that it takes a lot longer for me to warm up versus when I go afterward. The reason for this is when you're exercising, you're increasing your blood flow, you're increasing your core temperature, you're increasing all that blood flow. You're already warmed up more than you would be at your normal baseline. So then when you go into the sauna, it's going to take less time for you to heat up and start sweating. You're already in a elevated thermoregulatory status. When I go in cold without any exercise or anything, it usually takes me anywhere between 5 to like 10 minutes extra to get ramped up to the same degree that I would be post exercise. So, that being said, depending on where I'm at on the day, if I start getting lightheaded and it's only been 10, 12 minutes, I'm out. I'm out. I'm out. I'm out. I'm out. I'm not playing around with it. I'm not messing with it. I'm going to sit down for 5 to 10 minutes, sip on that water, cool down, and then make my way out. It's not something you want to play around with. If the sauna made me feel like chronically fatigued or felt like it was impacting my training, like I would go to train the next day or run or something, I would consider that I'm overdoing it, and I'd scale back. Again, I'm only going there 2 to 3 times a week. I usually book into it like Monday and Friday, and I try to sneak in like another time Sunday. So I'm not going that often, but I can imagine how if people were going 4 to 7 times a week, yeah, it could be impacting their training. Um, Periodize during very intense training phases. It would make sense to reduce the sauna frequency, specifically for like the runners and big heavy lifters. There might be like deload weeks where you could increase it, and then where you're really pushing it, you would decrease the number of sessions you go to. And remember that it's a tool, not a magic bullet. The sauna is there to support training, but not replace proper programming, nutrition, and sleep. I think a lot of people need to know that because everybody wants to treat something that they discover as the silver bullet that cures everything. It's not, though. It's just a tool, and it's almost always the culmination of all the different tools, all the different healthy habits that someone has that makes them the pillar of health that they appear to be. So here's the bottom line on the sauna for me: the evidence is compelling. Regular sauna use is associated with significant cardiovascular benefits, potential longevity effects, improved recovery, and weakly associated with some mental health benefits. It's accessible for many people, and if you can find it and you've been cleared to use it, it can become a very effective tool. For some people, though, that are very well off, a home unit can become the most cost-effective answer for them. Um, Most people do this already, but it should go without saying that anyone that's going to do or to start using the sauna, uh, assuming they've been cleared by a medical professional, they should start conservatively and build up a tolerance instead of trying to go in there and crank out the numbers. For veterans specifically, those who have like chronic pain, cardiovascular concerns, stress management issues, and they're talking to their doctor says to use it, the sauna can become a powerful tool because it's low impact, evidence based, and how easy it is to integrate it into existing gym routines. So, that has been the world's okayest physical therapist podcast on saunas. Thank you so much for hanging out. Again, please don't forget to like, comment, subscribe, and share this. Check out the website. Check out 10,000 for 15% off down in the comments description. And then check out Patreon for the notes because I'm starting to use that to house all those things instead of filling up these descriptions on the videos with like 18 pages of text. So, everybody stay healthy, stay fit, and stay awesome. And I will catch you guys all in the next episode.